Hi friends, this is Dr. Alok Patel from Mission Health Homeopathy. Today I am going to sharing a very wonderful case of infertility. A 28-year-old female referred by my old patient with the complaint of lower abdomen pain, irregular menses, and USG shows and diagnosed the case of PCOD. Presenting complaint was that lower abdomen pain aggravated by during and after menses, and pain relieved by lying down. It was her complaint, and she said she used to get headache, especially exposure of sun heat, and sometimes she used to get some episode of anxiety and palpitations. So I inquired more about her generals. She said appetite is poor and craving for spicy fish, chicken. Thirst was poor, sleep disturbing, sleepless, or thermally considered. I considered as a hot patient. Patient mentally patient is irritable. Sometimes throws things around, and I inquired about her previous illness. So there is no history of illness. Once she said once she aborted, and for this complaint she visited so many allopath and gynecologist, but she couldn't get a desirable result. As she's married since five year, but till now she couldn't conceive. So she visited to me. Now the patient is little expressive, less expressive. Many times I proved to tell something about her nature, about her life. She doesn't want to express herself properly. So I said, tell me about your stress and life after before 5 year back. So she shared incidents that her brother expired in an accident. While narrating this incident, her eyes was filled with the tear, but tear couldn't drop out. So this is very peculiar, and very peculiar in our this medicine, and very few only two or three remedies cover this symptom. Patient want to weep but couldn't weep, but eyes filled with the tear but couldn't drop out. So this is called as a controlled weeping. So this the patient of this remedy is very controlled. All the emissions are controlled. So you can say how this controlled, and you can appear the patient is appear and behave like a iceberg. You know that iceberg, the majority part of the iceberg is lies beneath the surface of the ocean, and very few parts, some tip of the iceberg only lies the surface of above the surface of the ocean. So like that, the most of the patients of these medicines behave like the iceberg of the ocean. So tip of the iceberg here, her eyes, there's lots of emotion inside her, but you can only visual see through her eyes. So controlled emotion, like eyes will filled with the tear but couldn't drop out. So you have to, being a physician, you have to observe this. Even many physician, many observer can overlook this, but if you understand this medicine, how this behave, the patient behave in front of you, you can catch easily. So it was the So it was the case, and there are so many observation. While my observation was also help in the case solving. Like I observed the controlled weeping, and patient is very reserved, and patient is dark complexion, patient all these I made the totality through all these object along with the observation and the what the data provided by the patient. Like first symptom was I have taken the consideration controlled weeping, दूसरा headache aggravated by heat of sun, and reserve, patient secretive, and acute chronic grief, prolonged grief. So all these is covered by the Netramure. So I prescribed Netramure 201 dose, and along with placebo for 7 days, for 15 days. Patient came back after 15 days. Patient was quite well and quite happy, but menses was not appear till now. I gave next follow up. I gave placebo only, and I call back her after a week. She came back after a week, after a month, sorry, after a month. She came after a month. She said that sir, my UTP is positive, pregnancy test is positive. She is now happy, and after and the patient was continue in SL, and after 9 months she reported that she delivered a very beautiful male child. So this is the case. Only one dose can recover the patient perfectly. So it was the case of the Netramule. So we have to understand the patient along with his gesture, posture, and through our observation. If the medicine is correct, medicine like the magic, work like the magic. So it was the case of Netramure. Many times you have seen I prescribe this medicine through the feel. So Netramure patient is very reserved, less talkative. There's a less blank kind of face, less expressive, and along with this controlled weeping is very important sign of this medicine. तो आज के लिए इतना ही. थैंक यू.